Good day, everyone. Today, on World Schizophrenia Day, we come together to spread awareness, understanding, and compassion about the mental health condition that affects millions of people around the world. Schizophrenia is not a sign of weakness, laziness, or a split personality. As many myths wrongly suggest, it is a serious mental health condition that affects how a person thinks, feels, and behaves. People living with schizophrenia may experience hallucinations, delusions, difficulty concentrating, or challenging in expressing emotions. But with proper treatment, support, and understanding, many individuals can lead meaningful and productive lives. Unfortunately, stigma and misunderstanding often hurt more than that illness may itself. Many people suffering from schizophrenia face discrimination, isolation, and fear from society. This is why awareness is so important. We must replace judgment with empathy and silence with open conversations.
Hmm.
World Schizophrenia Day reminds us that the mental health deserves the same care and attention as physical health. Families, teachers, friends, and communities all play an important role in supporting those affected. A kind word, patience, and encouragement can make huge difference in someone's life. It is also to remember the importance of early diagnosis and professional help. Mental health professionals, counseling, therapy, and medication can greatly improve recovery and quality of life of such people. On this day, let us pledge spread awareness about schizophrenia, end stigma and discrimination, support mental health education, encourage compassion and inclusions. Together, we can build society where every person is treated with dignity, respect, and hope. Thank you.
Thank you, Dr. Mohit. Hello. The theme for World Schizophrenia Awareness Day is Rethink the Label, Reclaim the Story. This theme focuses on breaking down harmful stereotypes, promoting empathy, and empowering individuals to define their own lives beyond their diagnosis. The key goals of the 26th campaign: uh, debunking myths, challenging the stigma that individuals with schizophrenia are inherently violent or untreatable. Early interventions, spreading awareness about the importance of recognizing symptoms and seeking early compassionate care. Community inclusions, encouraging community support to help patients recover and reintegrate into society. What is schizophrenia? Schizophrenia is a chronic mental health condition marked by symptoms like delusions and cognitive impairments, also hallucinations. In case of early onset, these chronic conditions can become disabling for many patients and their families. The illness therefore affects the social, personal, occupational, educational, and many other areas of lives. It affects approximately 23 million people globally, and yet stigma and discriminations persist. World Schizophrenia Awareness Day helps address such unfairness. Now, sign and symptoms of schizophrenia. Schizophrenia is marked by impairment in the perceptions of reality and shifts in behavior. A mental health hospital must be contracted on noticing any of the following symptoms. Schizophrenia is marked by the impairment in the perceptions of reality and shifts in behavior. A mental health hospital must be contracted on noticing any of the following symptoms. Delusions, which are fixed beliefs that something is true despite a lack of evidence. Second is hallucinations, or seeing, hearing, smelling, feeling, or touching things that are absent. Feeling like thoughts and feelings are generated and placed in the mind by the someone else or biggest broadcast. Doing bizarre or purposeless things or engaging in other type of disorganized behavior. Feeling extremely agitated or having slow movements. Having limited speech and emotional expressions. Now, treatment and long term management of schizophrenia. Schizo- uh, Schizophrenia treatment and long term management. Schizophrenia treatment continues lifelong. The approach involves a combinations of the medicines and the psychotherapy. These can help manage symptoms even when there may be no visible issues. If symptoms are severe, some individuals may have to stay at the mental health facility. For long term treatment, individuals can focus on quitting substances, resting more, learning relaxation and stress management, and joining a support group. The role of family support. Role of family support. Family members can play an important role in recognizing and managing symptoms. They also have a central role in making a patient feel safe and heard. They can help prevent relapse and enhance recovery. It is ideal to seek immediate help from the psychiatrist for schizophrenia and symptoms are noticed. Early interventions can improve long term management. If an individual experiences extreme distress due to social exclusion, is plagued by symptoms, or is losing touch with reality, they may require immediate and complete hospital care. So early sign is include delusion, hallucination, disorganized behavior, extreme agitations or slowed movement, reduced speech or emotional expression and social withdrawal. It can be cured, but it can be managed with consistent treatment. This can help reduce symptoms and may improve quality of life. Can people with schizophrenia live normal lives? Yes, they can live a normal life if they get the right treatment and receive support from the family and friends. Thank you.